What would be a funny thing to say to a surgeon before anesthesia kicks in 5 seconds later? The last time I tried to say something funny right before surgery, they were about to put me out and I said, double quote, "Go easy on me, doc. It's my first time." I gave a little chuckle and so did the doctor. He then picked up a scalpel and said, double quote, "Don't worry. It's my first time too." And then I promptly blacked out. Right before I went under to have surgery on my septum, I was about to start counting backwards before they put the mask on. Double quote, "Does anyone need anything while I'm out?" The last thing I remember was an all room full of people hysterically laughing. I'm gonna need to get surgery so I can use this. I was being wheeled into emergency abdominal surgery once and my girlfriend was with me. We're rolling down the hall and they have the mask out to put me under and I pause and say to her, "Don't let them touch my DCK." The nurse smirked a little and they put the mask on me. In somewhat of a panicked fashion, I pulled the mask off, stared up at my girlfriend, and with full weight and seriousness told her, "They can look at it, but no touching." I heard the doctor laughing as the gas kicked in. They had a thing checking my heart and it fell off and it flatlined. I told them, "God damn it, you killed me. Quick, we're losing me." Here's my impression of my wife during sex. Full stop. Full stop. Full stop. Edit. I'd like to dedicate the success of this comment to my wife. May she someday awaken from the coma. And or exist. Doctor. Not with me. You son of a bee. My twin owes me big time for this one. As they were pushing the drugs they asked me to count backwards from 10. All I could say was, "No." The room erupted in laughter and I was out. When I was a kid, they told me to count back from 10. So I did. I got all the 0. And all the doctors were looking at one another extremely confused. Then just before they were about to do something I conked out. "If I don't make it through this, tell my wife I want her to be buried alive with me. If I don't make it through this, tell my wife I said hello." When I had my wisdom teeth removed and was given general anesthetic, I apparently said, "If this is what being on drugs is like, sign me up." He went and told on me to my mother. After I came to from having my wisdom teeth removed they helped me stand up. I shook their hands off of me and yelled, "I've been drunk before," and proceeded to fall straight onto my face. Apparently my mom heard me and just had the Captain Kirk Fassapam going on when I came out. I once had to have my right hand operated on for a serious injury. Double quote. Dr. Grace. "Will we be able to play guitar after this?" Double quote. "Oh sure you will." Double quote. "Funny. I never could before." Double quote. The operating room feels silent. As the anesthesiologist was putting me under, he just said I'd start to feel sleepy soon. I asked him, "Aren't I supposed to be counting back from 100 or something?" He replied, "I don't know. I must have skipped that class." Being an anesthesiologist must be awesome as you can always get the last word in. I had an anesthesiologist that looked like Dan from Roseanne. He was awesome though. I had to have 2 eye surgeries and he was the anesthesiologist for the second one. He came in to explain the process and asked me, "So, I see you had surgery a week ago. So you know how this is done, right?" I nodded and said, "Yes, sir." His face suddenly got really serious looking and he said, "Excellent. Most people freak out when they see the hammer." "Who's the guy with the scythe standing in the corner?" "That's the other surgeon. He's sitting in." I was being put under for a wisdom tooth extraction a few years back. And it was the first time I've ever had anesthesia. They used injection method rather than gas. So they told me to watch the fluids going in so I could gauge when I'd feel sleepy. I had this idea that I would say something like, "Oh no, doc, I've lost my eyesight," or something else preposterous. Before I could collect my thoughts I just immediately blurted, Well, my voice progressively getting lower and passed out. I asked for a tummy tuck while being wheeled in for a bowel resection. I said, while you're cutting it open, just cut some off. Then when I was done my surgery, but still pretty messed up on drugs, I asked if I was skinny and then cried when my DR told me he didn't give me a tummy tuck. Same DR, different procedure. Terribly inappropriate joke. Had to have a colonoscopy. So they gave me some medication where I was awake. But like, it was weird. Anyways, I was feeling silly and told him. First time doing anal on camera. And I'm not even getting paid. When I got my wisdom teeth removed. Doctor. Double quote. Alright, so you feeling that sedative yet? Me. Double quote. Yeah, a little bit. I bet I can stay awake though. How long can people usually fight it? Doctor. Double quote. Not long. Good night. Me. Blackout. I remember laughing when I woke up because that was the last thing I remember. I had this exact same conversation. The only difference was I woke up halfway through them taking out my wisdom teeth. My mother could hear my yelling from the waiting room. The doctor was a little surprised. Edit. Would this be a good time to mention I had an upper GI scope last week and woke up during that too? This one was less dramatic. I made eye contact with the doctor and then tried to rip the scope out of my mouth. Then back under I went. Whoa. So many who have woken up during procedures. We should band together and do something. Something nefarious. Edit 2. I do not have red hair nor am I Irish. Till red hair can indicate a resilience to anesthesia. I tend to get massive erections while under anesthesia. But it's fine. Just tape it down if it gets in the way. Apparently that's actually a thing. The blood flow is actually usually stopped by a muscle. And when that muscle relaxes, the blood flow increases and causes boner. So the anesthetic relaxes this muscle. This also explains the random boners you get in algebra in high school while you were bored. I had just woken up after having my shoulder worked on. I was in and out of consciousness for a bit and just generally fucking whacked out. I guess I shifted in the bed and moved the blankets a bit and exposed myself as the nurse came in. She smiled and moved the blankets back. I apparently told the nurse, "You saw mine. Do I get to see yours?" My wife was in the chair next to the bed. I had broken my wrist and was being put under to have 4 pins inserted. They gave me my anesthesia through a knife. I felt coldness spreading up my arm and across my chest. The nurse asked how I was doing and I said, "This must be what dying feels like." I heard her say, "Oh my god." Then I was out. I actually did the same thing before both of mine. I managed to get out. Double quote. "I'll see you in the future, doc." Or something. Either way, once the drugs kicked in I didn't care. To the surgeon and nurse. Double quote. "I just want you both to know good luck. We're all counting on you." Before going under for wisdom teeth, the doctor said I might feel funny. They pushed the drugs and asked if I felt any different. My asshole. And only my asshole began to itch like crazy. And it was hot. Not warm. Hot like I just ate peppers with my ass. I told them my asshole is itching like crazy. The assistant was really bad at holding back a laugh. The doc resisted mightily. But he too succumbed to my newly discovered butthole emotions. For the record, my wife does not like it in the butt. Because I said this before my surgery. My wife is a nurse who works at the hospital I was in. I don't remember saying this. But her co-workers remember it. How did that go over later? She took it pretty well. I told her. At least I didn't say you love it in the butt. Whoa. I actually have a relevant story that happened recently. As I was getting ready to go under, they were placing a device in my mouth to keep me from biting down on the scope they were going to use for the endoscopy. Think medical ball gag. but a hard plastic ring instead of a ball. As the gal was placing it in, I asked, double quote, wait, what's the safe word? I heard a good amount of laughing as the world turned to black. Edit. A word. I want my baby back, baby back, baby back. I want my baby back, baby back, baby back. Then the surgeon will be all P said the whole time because you never finished it. As soon as you wake up, try and muster re-ibs. Chilies. Waking from anesthesia one time, I heard someone say, his blood pressure is a little high. Then I mumbled, that'd be the anesthetist assistant's fault. They then kinda startled, asked quickly, why is that? Becoming slightly more coherent, I continued with, she's really hot. They all laughed and said, he'll be fine, and released from theater. Here's one that actually happened. My grandmother's sister was getting an epidural done for one of her children. When she came to, everybody involved couldn't stop giggling around her, and she had no idea why. Until it comes out later that while she was doped, she had repeated one of my great-grandfather's favorite problems of logic. Double quote. If you're shoved up to your neck backward up a sheep's ass, and there's a bear coming to eat yak, what do I do? Do you pull your head in? Or bite the sheep's ass to make it run faster? It's a shame he died before I was born. That man. Related comment but doesn't really answer the question. My dad was in the middle of a surgery repairing some pretty nasty damage on his wrist after a skiing accident. He was under heavy anesthesia, but the surgeons were having serious trouble with the screws in his wrist, which apparently jarred him around enough to wake up. He noticed their struggles and managed to say, righty tighty, lefty loosey. Then he passed back out. So after my dad had a triple bypass and was just waking up and they had removed the breathing tube, I was in the room with him. I said something along the lines of, everything went perfect with your surgery, Dad. No problems. My dad in his drug haze said, that is because I am a perfect specimen of a human male. And it couldn't have gone any other way. Nurses were cracking up. Last time I went under, started to feel a sort of paralysis and couldn't move. Me. Double quote. Whoa. Did you give me something? Nurse. Double quote. Yes. Relax and don't fight it. Me. Double quote. Okay. But you should sell this stuff in the gift shop. Everybody laughs. Surgeon. Double quote. Are you okay? Me. Double quote. Yeah. But I'm disappointed there's no cake. Surgeon. Laughing. On the recovery notes, right, give the patient cake. Next thing I know, I'm waking up in recovery with a slice of chocolate cake on the table next to me. As an anesthesiologist, let me clear some things up here. Rarely is the surgeon, even in the or during induction, going to sleep time. Usually just the anesthesiologist or nurse and person that helps with instruments for the surgery are present. I've heard and seen every crazy thing imaginable, including people's deepest fears and secrets. Mostly this is caused by a pre-medication such as Versed removing inhibitions. Every now and again I'll hear something that will even make the entire room chuckle. 99% of the time whatever you say has already been said and isn't nearly as funny or original as you think. I often hear from patients in pre-op that their biggest concern is saying something they will regret. And I always reassure them the majority of people talk a lot less, and the ones that do talk usually hold relatively normal conversations for the brief period of time of getting a pre-medication to going under full general anesthesia. Now as we are talking a case involving moderate or deep sedation and not general anesthesia. It's completely different. If I were to have surgery and the anesthesiologist not know me or my profession, I'm sure I'd do my best to prank him by saying something completely obscure about anesthesia and just give him a wink. Edit. Since my inbox is getting filled with medical questions, please talk to your anesthesiologist the day of surgery about your complete medical history. It all matters. Let him/her determine what is important to your care. I had to have a pilonidal cyst removed from my ass crack and can remember giggling like a madman because I asked the entire operating room, so, Who drew the short straw and has to shave my ass? Wait. They put you under. I went into the ER for one when I was 19 and didn't have any idea what it was or why it hurt so fucking bad. The doc numbed me up. Didn't wait for the anesthetic to kick in. And started cutting. I started passing out from the pain and the nurse made me lie down while she commented, "OMG, there's so much blood." It was one of the worst pains I have ever experienced. Okay, so I know this is late in the thread. But when I was 15, I discovered that I could pull my foreskin back behind my penis head. Needless to say, my foreskin was so tight I opted for circumcision. My doctor, Dr. Lentz, was the funniest dude I've ever met. Told me my DCK was gonna look like Frankennis for a month or two, but it's cool. Anyways, I'm in the ER on Christmas Eve and I feel the anesthesia starting to kick in. And before Dr. Lentz walks out, I shout slur, "Doc, please, just take care of the little guy." And he stops, turns around, bows to me and says, double quote, "as if he were my own." I laughed once then passed out. A couple of years ago while I was being prepped for bone surgery, I had a good rapport with the anesthesiologist, my dad is one, and we kept talking about pain management and such. He pushed the dose of ketamine and propofol into my eye and my brain was getting foggy. I remember seeing him laugh in his ass off as I went to sleep. When I woke up, my friend who was attending the surgery told me that while I was dozing off, I told the surgeon, "This is the very first time I tried ketamine non-recreationally." As I was going under for gallbladder removal, at the time 25-year male, the surgeon said, "Now you're not 40 fat frumpy and female, are you?" "The most common demographic for gallstones," I replied. "No, and I better not be when I wake up." They laughed so hard they had to put their tools down. And then he cut me.